my name is Rachel Eddy, and I'm going to be your student nurse practitioner today. I have here that your name is Maverick, is that correct?
Yes.
All right, Maverick, so today we're going to be doing a focused exam of your gastrointestinal system. First, I'm going to go over your vital signs. Maverick is a 25-year-old male. He's alert and oriented, responding appropriately to my questions. He's dressed appropriately for the situation and doesn't appear to be any acute distress. His height today was 5'8". He's 200 pounds, temperature 36.9, heart rate 78, respiration rate 16, blood pressure 117/72. His oxygen was 98% on room air. So I'm going to have you lie flat for me, please.
Okay.
Inspecting the abdomen, it appears symmetric. Skin is pink. There's a scar on the right chest, but otherwise no other skin abnormalities like a rash or striae. The umbilicus is midline and appears a normal depth. There's no bulging or masses that are visible. Peristalsis is not visible, and the aortic pulse is not visible. Contour is flat with no inward or outward deviation. I'm going to listen to your abdomen now for your vowel sounds. I'm going to listen for 30 seconds in each quadrant for a total of 2 minutes. Vowel sounds are normal active. They're low intermittent gurgling, occurring 5 to 34 times per minute. There's no abnormal sounds like tinkling or rushing. So now I'm going to listen for bruits in your abdomen. I'm going to start with your aortic artery. It is going to be halfway between your xiphoid and your umbilicus. No bruit auscultated of the abdominal artery or the aortic artery. Now moving 1 inch laterally to each side are your renal arteries. Okay, no bruit of the renal arteries auscultated. Now listening to your iliac arteries, they're 2 inches laterally of your umbilicus. bruit auscultated of the iliac arteries. Now listening to your femoral arteries or towards your groin. No bruit of the femoral arteries auscultated. Next, I'm going to be listening to your right upper quadrant for your liver, and then the left upper quadrant for your spleen, listening for venous hums and friction rubs. So using the bell of my stethoscope, I'm going to listen to your right upper quadrant, to your liver for a venous hum. Left upper quadrant to your spleen. No venous hum auscultated. I'm flipping to the diaphragm of my stethoscope. I'm going to listen for friction rubs in the same spots. Okay. No friction rubs auscultated over the spleen or the liver. Okay. And moving on, I'm gonna percuss your abdomen over the 9 fields. Scattered tympany throughout. There's areas of resonance and dullness, which is normal. In your right upper quadrant, there's dullness over the liver, and in your left upper quadrant over your trope space, and then in your stomach there's normal tympany, which are all normal. So next I'm going to measure for the span of your liver. I'm going to start percussing around your right breast at the 3rd intercostal space down until I hear dullness. Liver span is approximately 7 centimeters, which is normal. Lay this back down. Okay. And next I'm going to percuss in your left upper quadrant around your spleen for splenomegaly. Okay, I'm going to find your trope space on the left side. This is where the 6th rib, the lower costal margin, and your axillary line meet. And finding Castell's point, which is the point of the triangle, I'm going to percuss here. Any tenderness with that?
No.
Okay. Tympany with percussion, no tenderness. There's no signs of splenomegaly. Okay, so next I'm going to start palpating your abdomen. You can put this under your head, and then can you bend your knees just slightly for me? Yep, that's perfect. All right, I'm gonna lightly palpate. Hope you lower your knees just a teeny bit more. Yeah. I'm gonna lightly palpate your abdomen in all 9 areas again. Any tenderness with any of that?
No.
Okay. No tenderness of the abdomen, no guarding, and there was no palpable masses. I'm going to be palpating your abdomen again, this time with a deeper palpation. I'm going to use both of my hands and go about 2 to 3 inches in.
Okay.
if you feel any tenderness.
Nope. Nope. No. 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 Yeah, no.
Okay. No tenderness reported, and again, no palpable masses. Next, I'm going to be testing for rebound tenderness. I'm going to press in deeply and then release quickly. Tell me if you're having any pain.
No. 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 And no.
Okay. No rebound tenderness is present. No guarding, therefore no peritoneal inflammation is present. Next, I am going to palpate for your liver edge. Using my left hand, I'm going to place this underneath your 11th or 12th rib. Can you take a deep breath for me? You can let it out. Okay. Liver edge is approximately 3 centimeters below the costal angle. Liver edge is soft. Moving over. Oh, no, I'm going to do this side. Right, so now I'm going to feel for your splenic tip. I'm going to reach across you with my left hand. Feel for Trope's point. Okay, can you take a deep breath for me again? Let it out. Okay. Splenic tip is deep within the costal angle. Any tenderness with that?
No.
Okay, no tenderness. Now I'm going to feel for your kidneys. Okay, any tenderness?
No.
Okay, no tenderness for the kidneys, and no kidney enlargement is felt. I'm going to have you sit up for me. If you could turn that way so the camera can see you.
Sure.
Okay. I'm going to test for CBA tenderness. I'm going to lay my hand here and I'm going to strike it with my fist.
Okay.
Any tenderness?
No.
Any tenderness?
No.
Okay. No CBA tenderness reported. You can lie flat back down for me again, please.
Okay.
I'm going to feel for your aortic width. Okay. Aortic width is about 2 centimeters, which is normal. Now I'm going to be testing for cholecystitis. I'm gonna palpate in your right upper quadrant. I just want you to tell me if you're having any pain.
Okay.
Any pain with me doing that?
No.
Okay, no pain reported, no evidence of cholecystitis. Now we're going to be testing for appendicitis. There's going to be 3 different tests. We'll start with the Robsing sign. I'm going to palpate in your left lower quadrant, and I want you to tell me if you have pain anywhere.
Okay.
Any pain?
No.
Okay. No pain reported by the patient anywhere in the abdomen, specifically the right lower quadrant, so there's no evidence of appendicitis. Now I'm going to have you lay over on your left side in left lateral decubus position.
Yeah.
Okay, we're testing for So's sign. I'm going to have you extend your right lower extremity back for me. Okay, any tenderness with that?
No.
Okay, no tenderness, no signs of appendicitis. I'll have you lay flat back for me again.
Okay.
Okay, and the last is the obturator sign. I'll have you bend your right knee at a 90-degree angle and flex your hip in and outward. Okay, any tenderness with that?
No.
Okay, again, no tenderness noted by the patient. Obturator sign is negative, and there again is no evidence of appendicitis. All right, and that concludes our abdominal assessment. Thank you.
Thank you.